Let's now turn our focus to the vaccine issue as far as India is concerned. We've been seeing a lot of, several of the deaths that have been occurring are of people who are unvaccinated, which also shows that there is some amount of vaccine hesitancy that is still there. And also in data that is coming about that show that vaccines actually work. In fact, as per Kishori Pednekar, the Mumbai Mayor, who said that 94% who died due to COVID-19 so far since Feb 2021 were unvaccinated. So that is also an important factor here at this point in time. Whether you look at Delhi, Chennai, similar data all coming in that show vaccines, how they work and how effective they really are in terms of the severity of the disease itself. Let me welcome our guests who are joining us. We've got Dr. Amol Deshmukh, Dr. Narendra Gupta and Dr. Yatin Mehta, all of them joining us today. Thank you so much and thank you for patiently waiting by as well. But Dr. Deshmukh, if I can come to you first, this fact that the importance of realizing the efficacy of vaccines, what they are meant to do, because even now there is a misconception that vaccines should help me not get the infection altogether. But the fact is that vaccines help you to reduce the severity of the infection.
Yes, definitely. It has been recommended by the World Health Organization that vaccines do have an effect against Omicron as well. Obviously, there are various studies which are currently going on, but people suggest that immediately there has an effect and it wears down as the weeks pass. So, and more importantly, wherever there are elderly people and with comorbidities, it has mentioned that the hospitalization rates have come down in various countries. So definitely there is a case in favor of vaccination.
Okay. Dr. Gupta, coming to you here, we are still seeing the kind of data that is coming about. A lot of the deaths that are taking place are among those who are unvaccinated. So it does show, of course, that the people who are vaccinated are, seeing a lower impact of the COVID. But the vaccine hesitancy, how much of an issue do you think that still is in the country right now?
So first, thank you. And then it's true that vaccine works and the evidence is very clear. Those who are dying now, once the vaccines are out and people are getting vaccinated, people mostly who are dying are those who have not got the jab. So evidence is very, very clear. Now the hesitancy is essentially because that people have no idea about what is a vaccine, how does it work, and they have their own notions and other kind of beliefs about medicines in general and vaccine in particular. And for that reason, there could be all kind of bizarre thinkings in their mind. Like I work in villages, so many of the times we come across the people who will say, okay, how do you ensure that the vaccine will not let me die? Can you give me in writing? Some people have we are so hardworking people, nothing would affect to us. So all those kind of, beliefs and understandings are there. And those are the reasons for hesitancy. And these can be removed. If we could explain them in a very simple language that what vaccine is, how does it work? It works exactly if you give some very simple analogy, like when you are out somewhere and somebody tries to attack on you, you try to save yourself by all your might and all your strength. So similarly, if a microorganism gets into your body and that also attacks you, so there is a body system which has to get geared up in order to fight it out. And that fight could be further boosted and strengthened by using the vaccine. And what actually vaccine is? Vaccine is the thing which alerts your body for something which may come later in a wild form and attack you and cause you big harm. So those kind of things and simple analogies need to be given. And we have done it, and I have found that hesitancy disappears. And lots of people come forward to get jabs. But those things perhaps are not happening to the extent. So hesitancy still exists. but it can definitely be taken care of by doing interpersonal discussions, not so much by the mass propaganda.
Yes, absolutely. And Dr. Mehta, the other aspect here is of booster doses. We also just heard the Prime Minister saying that, the faster our healthcare workers and frontliners get booster doses, the better it will be. And obviously, even data has shown that. But any, assessment that you can give us from what we know so far, how much more, does that booster dose actually help in terms of protection?
See, in terms of protection, the booster dose will jack up your immunity by 200, 300%. I mean, what boost you get after the second shot, this is many, many times more, the booster shot. So, I mean, this will protect you against severe disease. So, as rightly said by my previous speakers, one must convey to the people that it not necessarily prevents the disease, but if they get the disease, it will be milder form. They'll recover in a few days' time. They will not need hospitalization or oxygen or ventilation. So I think that is what needs to be emphasized. And the booster is more effective than the second shot. And now more than 150 jabs have been given in this country, crore. So I think the evidence is there. Both the vaccines are extremely safe. The side effects are very, very trivial. And there's hardly any risk of them. And I think the risk of mortality is much higher. Even the South African data, it was very evident that most of the deaths and hospitalizations were in patients who had not received their vaccines. And the reason not only was vaccine hesitancy, but it was also vaccine availability, because of Africa does not get so much of shots. India, fortunately, has been able to overcome that problem, and not only we have enough vaccines for everybody, we are also exporting vaccines, and it's free in the government setups. So I think you people channels are doing a good job of reducing vaccine hesitancy, and I think this is the best protection against COVID at Omicron at the moment.
Yes, absolutely. And in fact, Dr. Deshmukh, I wanted your view as well as far as vaccine hesitancy is concerned, because earlier, at least, we used to see a lot of such incidents coming in from especially rural parts of the country. Even now, there are people who are extremely hesitant to take the vaccine. What is your own sense of that situation, and how best do you think that awareness can be increased?
I think vaccine hesitancy has improved quite a bit since the time that we have started vaccination. As you mentioned, rural areas, there are still people who do not want to have, because of the earlier notions that it has risk, the deaths that have been seen in certain vaccine trials and so on and so forth. But if you look at from a public health perspective, the ground workers, which are basically the ANMs, the ASHA workers, the multipurpose health workers, or in some states, we have the public health cadre. The whole idea of the ground workers is to ensure that they reach out to these people. And that's what a real public health work during such pandemic is. If you also recollect, at least in Maharashtra, that we have seen firsthand, that it was these ground level people who helped rural people to seek advice, to seek medical help if they had any COVID-related symptoms in the first wave, more so in the second wave. And I think they are those workers who are actually helping in the vaccine hesitancy, and now more and more people are taking up vaccines. Secondly, public health also means that the public representatives, the private sector, civil society, they all come together for a community need. And we have seen during various waves that many of these community leaders have come out and organized various camps and taken them to the people and the community. So that has also reduced quite a bit of vaccine hesitancy, and more people have done that. Finally, I think what we have are about 62% of eligible adults have had full vaccination in this country. We still have around 30-40%, and about 90% have at least got one jab, which is a good news. We cannot deny that we started vaccination a little late, but yes, we are getting there. and the booster doses for healthcare workers as well as children, that is also getting a better support, the young adults. So I think we will be safe as the days pass by as well.
Right. Dr. Gupta, the other problem, that we're also seeing is people who take the first dose and then don't take the second dose on time, or, lose the window, even though there is such a big window when it comes to Covishield, for example, smaller window for Covaxin, but nonetheless, if you can just elaborate a little bit on what is the consequence of such a decision of not taking the second dose, for whatever may be the reason, but not taking the second dose in time.
One of the things is a very casual attitude towards health as far as the vaccination is concerned. And then secondly, they do not see lots of people falling sick into their neighborhood now, after, especially once the second wave is over. So they are taking it in a stride, in the sense that nothing much would happen, and means somebody had persuaded them in the first time, then they had. So it was, I would say, the absence of health consciousness to a certain extent. And then also, this is not exclusive to only COVID for that matter. COVID has come as a pandemic, so we are all alert, and there's so much of, noise around it, and so much of preparation around it. And first time in the history, perhaps we have experienced lockdown. All those kind of things have alerted people, but the kind of consciousness which is needed, not only for COVID for that matter, for all kind of communicable diseases, is still lacking in certain section of people in rural areas. Other than this, I also want to flag one important point, I think, which is not so much directly related to vaccination, but it does need to be taken note of, that as the number of cases are increasing right now in the third wave or fourth or fifth wave in other countries, the fatality is continuously, vertiginously, in fact, if I use the word vertiginously, coming down. In fact, the case fatality rate, which was about 0.6% globally, a week back now has come down to 0.4%. So people are getting infected, they may be getting mildly diseased also, but the number of deaths are continuously declining. And these type of reasons are adding people not to really care for second dose or even for precaution dose. These are different kind of things, but different things happen in different areas. Like certain people have certain kind of beliefs, and because of those beliefs, they think that they'll not take any kind of a foreign medicine, which has some kind of a foreign touch to it. So these are also the reasons. So one needs to go personally, interpersonal, discussion, counseling are very, very important for these kind of people who have hesitancy. Because the people who are left now, who still have not got their shots, are highly resistant towards vaccination, against vaccination, sorry.
Right. Yes, absolutely. Dr. Mehta, I want to just go on a bit of a tangent here and just look at the situation that we are seeing, especially in metros. Mumbai is seeing a slight spike after seeing a 3-4 days of cases coming down. Delhi has been seeing a continuous spike. In fact, the number of deaths are increasing and have gone up. So while there is this perception that the intensity of the disease is not as much this time round, there are more and more cases where people are seeing heavy symptoms, and it is showing up in that manner. But your sense of what's happening in Delhi?
No, I think, see, this is one of the reasons probably people may be taking it casually, that they think that the disease is milder and people don't die. Well, I will confess that the percentage of people this time with the Omicron maybe who get the serious disease or critical illness, who get admitted to the hospital, who require oxygen, who require mechanical ventilation, and certain percentage would die, is less than what it was during the Delta wave. But that still does not make the disease that benign. Because if the transmissibility is more, and the numbers are more, which we are seeing every day, then obviously, even if the percentage is small, the absolute numbers will be significant. And for a person who's died or his family gets affected, for them it is 100% mortality. So I think numbers crunching is okay for public health point of view. But I think we must emphasize that the disease is not completely benign. It does make you very sick. It can make you very sick and it can kill you. So I think it is important that everybody should take the vaccine and we continue with COVID appropriate behavior during this period. That's the only way. Two things which we know can protect you for the time being.
And Dr. Mehta, just one more additional point from you in terms of the space at which we are seeing Omicron, spreading. We're seeing sort of 2.5 lakh cases, and the speed that we've reached this 2.5 lakh cases from a few thousand cases just a short while back. How concerning is that? Because like you said, if the spread is that much, the percentage itself, the absolute figures will become significant of severe diseases or deaths.
US has crossed more than 1 million a day. I mean, cases. I mean, if the US is 1/3 the population of India, and that it is crossing 1 million, and we are also now, the graph is still going up. I think we got falsely secured by Mumbai numbers going down consistently for 3 to 4 days. But we know the reasons for that. The number of tests had gone down. Also, people testing themselves by these antigen kits at home and not declaring it to the public health people. So obviously those cases are not reported. And we are seeing in Delhi, I'm seeing that almost virtually every family gets affected. And once a family member gets it, the isolation is not proper, the follow-up at home is not proper, and every family member gets affected. This is a much more, if I can use a term, it's a wrong term, contagious or transmissible disease than the Delta variant. It spreads much more, 7 to 8 times more transmissible than the Delta variant. So, I mean, if the absolute numbers go up, people will fall sick. I think we have to realize that, and we do not want to reach a stage. Last time, what we were with the Delta wave, that oxygens were not there, ambulances were waiting outside every hospital, waiting to get admitted. We did not have beds. So our infrastructure has certainly improved. But maybe if the numbers explode, we may not be able to cope with it. So I think we have to be prepared for the worst, and we have to do everything in a power to try to prevent it and not reach those numbers.
On that point, Dr. Deshmukh, because even in the past, whether we look at the first wave or the second wave or even what we are witnessing right now, we've always followed what's been happening in many of the Western countries. In terms of the COVID-appropriate behavior, it seems that India is slightly better than, many of the other countries. And there are countries which are also now treating this as an endemic and reach that stage. Given all of this, how worried are you about the pace at which we are seeing an increase in cases?
I think I'll just refer to the WHO 7th January. They have released a document and they mentioned that it is obviously a global risk. The transmissibility, as the earlier speaker has mentioned, is about 8 times. So there is no denying that the people and we will all catch up with these Omicron as well. Now it is time that will tell us how soon that happens for a maximum number of people, and the smaller percentage of hospitalization, how does it actually exhaust our current healthcare infrastructure? So I would definitely be worried depending on, India is a very populous country and we all know that. We have still rural population, we have urban population, we have slums, and that is gonna come up and show up. As you mentioned, we have certain social behaviors which are better than some countries, but I think the population density in certain areas will probably create a risk. So I think we might see hospitalizations more and more reaching to its full capacities probably in 2 to 3 weeks' time. And hopefully all those with comorbidities, those who are affected, elderly people, take huge care and precautions, well-fitting masks, physical distancing, ventilation of indoor spaces, hand hygiene. These are the 5 things, and the government and the public health should obviously be worried about doing rapid testing, cluster investigations, contact tracing, isolation of cases, and supporting quarantine of contacts. So these five things of each, the individual as well as the government, public health. If we do that, hopefully we will not see what we've seen in wave 2, but we all need to be very, very cautious.
Yes, absolutely. Dr. Gupta, final word to you here in terms of, what would you like to tell people who are watching, who probably need to be urged to either get that second dose or get their booster dose or even get their first dose for that matter, because that is still a significant number of people who do need to do that. Dr. Gupta, if my voice is reaching you, that question was for you. Dr. Gupta, I think you're on mute. I would request you to unmute yourself, please.
Okay. So what I could say is that is already known. Those who haven't got the first jab should go and get their first shot without any delay. And the second jab is, if already due, they should also again not delay for the second jab. And those who are eligible for getting the precautionary dose, they should also get the precautionary dose, because the evidence is very clear that vaccination has prevented the severity and death possibility could happen because of the this COVID-19. Omicron, for that matter, is highly transmissible, and perhaps there is a belief that it has already reached out into the community to the extent that now already ICMR has issued a guideline that asymptomatic contacts of the symptomatic COVID positive should not be done. So that is a good strategy, because it was unnecessarily increasing the number of positive people with no concrete gain out of it, and it was also creating some kind of a panic which was not needed. The need of the hour is to have a more nuanced, well-planned, well-curated strategy to deal with it, and also deal it along with other health problems and other health issues which are there in the community. So this is what I would like to say. Okay.
All right. On that note, I'd like to thank all of you, Dr. Deshmukh, Dr. Gupta and Dr. Mehta, for taking the time out and speaking to us. This is an extremely important issue, and we will keep talking about it and keep discussing it and taking up all aspects of this on Mirror Now.